to another edition of the Lynn Lowdown. Today we have Mass State Rep. Mr. Dan Cahill. How are you doing, sir?
I'm okay, despite the circumstances. Michaela, how you doing?
I'm good. I haven't left the house in days, so you can tell by the facial hair.
I like it. I shaved the other day, and I shaved my head because I couldn't get to a barber, so I just did the Corona crew cut.
Yeah, that's my next step. I might have to cut my own hair because I haven't been to a barber in a month. but how's everything going? Since the reports of everything being shut down, everyone being ordered to stay home. On your end, how's everything been?
Clearly, this is an unprecedented time in our nation's history and maybe in humankind. We continue to remain very busy. A lot of constituent calls and emails and questions about how the state is responding to the COVID crisis. Folks are worried about access to healthcare, whether it's for corona testing or it's just for their general health. A lot of questions about the economic impacts of the COVID and the shutting down of businesses. I can tell that the state is starting to process some requests for business loans. The governor had indicated a $10 million fund. I can tell that the decisions are being made because now I'm starting to get contacts from businesses who've been denied and wondering what the next step is for them. Stimulus money from the feds is, I believe, starting to come in. Questions about SBA loans. So there's a lot of questions. I'm short on a lot of answers because these are all pretty much newly created in the last couple of weeks programs. Yeah. And we're just trying to work through that. And then housing is another big issue. Hearing a lot from tenants, landlords, commercial and residential, about what all this means.
Yeah. Speaking of businesses, there's a lot of small businesses in Lynn in particular, and we all knew this would affect them dearly. Just with the calls, what are some of the things you were hearing when you were receiving calls from small businesses?
Well, what you would imagine, with no revenue coming in, and a lot of these folks, like you said, small businesses that live receipt to receipt. When you take away a day, 2 days, a week, some months worth of revenue, you can't survive on that, especially if you're a small business. So we're hearing a lot of just angst and anxiety about what to do next. And I'm very nervous because a lot of small businesses in Lynn, if you looked over the course of the last several years, they're many women-owned businesses, many minority-owned businesses, very entrepreneurial in nature. And this comes along and just wipes out people and wipes out a lot of times their life savings that they put into this. And it really impacts a lot of families, and it impacts the local economy in Lynn. It makes it harder for us to be able to do the things that we want to do when there's a lot of empty storefronts and folks not being able to pay their taxes and their commercial loans, and it's devastating.
Mm-hmm. And a lot have been surviving on drive deliveries, people coming in, giving tips, but it's not the same when they can't dine in. They won't get the same revenues, because not all the time people are ordering for a takeout all the time. Some people come in, but at this time it's not happening frequently. So that we could see where they take that major hit.
Yeah, a lot of questions were raised, I think, about why the governor allowed for the takeout places to remain and let bars and restaurants do takeout. A few things. One, a lot of folks don't have the capabilities of cooking in their own home. So to take away the idea that folks can do takeout is dangerous to a lot of folks that aren't able to, they're renting rooms, or they just don't have the means, or they have disabilities where it precludes them from being able to cook for themselves. So that was important. But we've heard, as a result of that, more stress is put on businesses. And so the governor then, working with us, allowed for restaurants to then that have on-premise alcohol licenses to then package alcohol products and send them off with the takeout to people, which is novel, something that I don't think you'll ever see again, or something that will stick around. But it just goes to show that at this point, anything kind of goes if it's an idea that could potentially help businesses, but at the same time not make a terrible impact on the spread of COVID. It's a balancing act.
And another impact that you touched on was rent. Rent around the city, rent around the country. We've seen in some places landlords have frozen rent for some of their tenants, but that's not the case for everywhere. As far as trying to get people to pay rent or maybe freeze rent, how have you guys developed something to help those individuals?
Yes, both the House and the Senate have been working on that. The House had put out a bill recently, as of early last week, that would add some levels of protections for commercial, which I was surprised it includes commercial and residential tenants, in the sense that clearly now courts are closed to the public, open only on an emergency basis. And when we talk about emergencies, we talk about things like folks that have been, arrested and are going to be held on bail. Like we saw last night, there was a shooting in Lynn. Those folks, obviously the people involved in that will be arrested, arraigned. So the courts will be open for that. But they're not generally taking these eviction notices cases. So that is a kind of a level of support. But the House passed a bill that would allow or preclude the accrual of interest, prevent the eviction notices or eviction proceedings to go on until COVID expires, or I don't know, I guess we eradicate coronavirus. So there are some protections. We're working with the Senate to work out some differences. I think we'll get there and put it in front of the governor to sign, hopefully sooner rather than later, because time is of the essence. But, folks shouldn't be expected to come up with rent at this time when they are out of work and we're demanding people stay at home. That's a key component. We're asking people to stay away from other folks, but you can't have people on the streets because they can't pay rent, because we're telling them to come home, stay home, so they can't go to work because we closed their work. You see the cycle I'm getting at? Yeah. So this is unique. We've heard from landlords that aren't happy. I understand that as well. However, this is how it is. We've closed businesses, and if they're a landlord of a business like rentals, then they're going to have interruptions too. Everyone's being interrupted.
Yeah, and Mayor McGee, I know I saw this the other day at somewhere being a safe haven or a place for people to go to stay in the North Shore. I saw it in the item. I can't quite pinpoint what it was, but I think it was like housing for certain folks, people that may need housing. I don't know if you saw that.
Well, right when COVID and Corona hit, we were in constant contact with the city and working with the mayor and the city council, and talking with the state about what do we do with residents or folks that don't have a place to live if they contract the virus, trying to get homeless off the streets. We have a large homeless population, and those discussions are ongoing. We're finding that we can pinpoint locations to create temporary shelters for folks, but we're running into the same problem that hospitals and nursing homes are running into, in that staff, trying to find folks to staff these things. Clearly, our healthcare providers and emergency first response folks are completely spread thin. They've been putting in incredible amounts of hours, brave individuals sacrificing their own health, their own family's health at home to take care of others. And it's difficult to be able to find additional folks who want to work specifically with a population that could very well be infected with coronavirus. And I know that the governor and other folks have asked for retirees to come back and help out if they can. But generally, if you're a retiree, you're of that age group that is a target for coronavirus. Mm-hmm. So we're running into a people problem. Yeah. We're a real staff issue.
Yeah. It's wild. I never would have imagined this in my lifetime. And also, we also got the notice that school may not get back. School may be done for the rest of the year, possibly so. And that's kind of a bad hit with the teachers and as well as the students, because from what I've noticed, nobody was prepared for this, especially for the teachers. So for them to adjust their teaching curriculum on the fly like that, this was very unprecedented for them.
My wife's a public school teacher in Lynn. Thankfully, she is, in a sense that she's been homeschooling my two children. I don't know what I've done if she wasn't an educator and able to kind of piece together a great curriculum, but it's a real challenge. I've talked to a lot of teachers. There are a lot of anxieties out there about the school year. And clearly I'm not the ultimate decision maker, but what I tell folks is, as we all know, this is a very unprecedented time. And folks are mindful that there are some impossibilities. And I don't think anyone's asking someone to do the impossible. So when I hear about folks worried about MCAS testing, I'm not worried about whether or not there'll be MCAS testing. I strongly believe that's not going to happen, and we're moving to give the Department of Education, Early Secondary Education Commissioner Riley, the authority to postpone MCASs, but he's going to cancel it. The school year, I don't see us coming back, because even if you come back, even if we are able to ride this curve out in the next week or two, there's a downward curve. That means people are still infected. We still can't go out because we're just going to ramp up the curve again. This is not confirmed, but I'd be surprised if we went back to school. I'd be surprised if there would be any type of requirements for MCAS or graduation requirements is all. And folks, I think, have to understand that the focus right now is on healthcare workers, on healthcare access, on testing, on public safety, on the economy, on housing. School's out. It's kind of something that we will get to, we will deal with, but the priority has to be on healthcare. It has to be on eradicating the coronavirus. So folks that are a little bit nervous, I would say, obviously there are other things we're dealing with. I wouldn't be too worried about if we even went back to school. It's not like the government's going to ask teachers and students to perform the impossible. Yeah. It's just not fair. Yeah. It's just, but we're focusing on other things right now. So I wouldn't get all ginned up about whether we're going back to school and the MCAS. I just don't see that happening.
Yeah, definitely. Now, what are some other things happening state-wise that you guys are currently working on, to moving forward with this?
Well, I'm on a lot of Zoom meetings and a lot of conference calls lately, more than I ever have. And we just had a conference call yesterday with Mary Lou Sutters, the Secretary of Health and Human Services, and she has a periodic update for legislators. And the news coming out of the state, which again is shared. I think I get a lot of these asks about, hey, you must know the real scoop and you must know secret information. There's nothing I know that the general public does not also have access to. I may hear of things a minute or two before they're released, but nothing to the point where I have a secret information of what's going on. But Massachusetts is trying to tackle this like every other state. PPE, the equipment that we're using to try to protect folks, it's difficult to get your hands on. Massachusetts has been very aggressive. The Kraft family was incredible on providing so many masks to not only Massachusetts but surrounding states. But it still remains a challenge. I get emails and texts and phone calls from healthcare workers who are saying, we still don't have enough testing. We need more tests. We're trying to test patients. We're also trying to test our own workers, and we just don't have the access or the turnaround time for these tests to feel comfortable in providing our services going forward. Mm-hmm. Cleaning PPE, and again, access. We've tested as of yesterday, I believe over 81,000 tests have been administered in the Commonwealth of Massachusetts. We'll wait till 4 o'clock every day. And folks, if you go to www.mass.gov, it has amazing updates. Every day at 4 o'clock, there's an update from the governor's office. Over 15,000 confirmed cases. I think you saw yesterday, or maybe today, reported over 300 in Lynn, nearly 28 deaths in Lynn linked to coronavirus. So the numbers they're continuing to grow. We're hopeful to hit a plateau or at least going to be on the downward end of the curve in the next 10, 14, who knows, 20 days. But Massachusetts, like most states, are just trying to stay ahead of the next wave of needs for patients and for our first responders and healthcare workers.
Yeah, and last week, the Kraft family donated a whole lot of masks to healthcare workers for this pandemic, which was a positive note on this event.
Oh, he saved us. We've been seeing the federal government kind of outbidding us on some bids for PPE and in some cases commandeering our resources. And nursing homes, as you've seen as of late, real spike in real concern about coronavirus going through nursing homes rather quickly. The state yesterday allocated 120,000 masks to nursing homes for patients and for providers, the health workers that are there taking care of them, because as you can imagine, that's our most vulnerable population. If you look at the death rates, a lot of folks in their 80s, 70s, 80s, and 90s that are succumbing to coronavirus. And so we're making a conscious effort now to make sure that the nursing homes are best equipped to try to handle this. But there's still a tremendous need out there for more equipment.
All right. Oh, we came to the end. Dan, thank you very much. Can you give that website one more time if anybody wants to keep up with the updates?
Go to www.mass.gov, and right on the top of it, it'll say coronavirus COVID-19 updates. Click on that. It has everything from daily updates to resources to confirmed cases. There's charts on where the cases are found. Essex County is generally running in third place right now for the highest amount, behind Suffolk and Middlesex for positive COVID tests. But there's a ton of information. And again, what's best about this is that it's accurate information. There is so much on the internet of misinformation and misleading information. I don't know if it's intentional or just folks just thinking these things up, but I've seen some real dangerous material and information on the internet. You have to be careful about the source. I strongly suggest go to Massachusetts specific information, and of course the City of Lynn's website, the Mayor McGee's website has updates as well. And I know of every elected official, we pretty much have newsletters. If you want to get caught up, ask for email lists, newsletters. There's a lot of shared information via social media as well. And of course, Lynn Community Television is a great resource for all your local needs.
Thanks for the plug. All right, Dan,
that's right.
You and your family be safe, and hopefully when this is all over, we'll get you back in the studio as always.
I'm looking forward to seeing you, Macaulay. All right, you take care and tell everyone I said hi, and make yourself some popcorn. I can tell back there on the fridge or something. You get something good. You get some snacks up there. So make sure you're well fed.
Yeah.
And wash your hands. Make sure to wash
constantly. Every 5 minutes is the hand.
That's good. And wear a mask when you're outside.
I'm not stepping outside anytime soon.
Smart.
All
Smart.
Right.
Even better.
You have a good one.
All right. Thanks, everybody. Stay safe.
All right. Bye.
Bye-bye.